Question 1. A patient with Addison's disease is admitted with severe hypotension after missing 2 doses of hydrocortisone. Which is the priority nursing action? A. Administer 4 fluids rapidly. B. Administer 4 hydrocortisone as prescribed. C. Place the patient in Trendelenburg position. D. Monitor urinary output. Answer, B. Rationale: Addisonian crisis equals acute adrenal insufficiency. Immediate 4 corticosteroid replacement prevents cardiovascular collapse. Strategy: in crisis questions, identify the hormone that's deficient and replace it immediately. Question 2. A COPD patient becomes drowsy with a PaCO2 of 80 mm of mercury. What should the nurse do first? A. Increase O2 to 6 liters per minute. B. Notify the physician. C. Prepare for mechanical ventilation. D. Reposition to Fowler's. Answer, C. Rationale: PaCO2 greater than 70 equals ventilatory failure requires ventilatory support. Strategy: always act on ABCs. When CO2 retention causes hypoventilation, support breathing first. Question 3. A cirrhotic patient develops confusion and flapping tremor. Which lab supports the diagnosis? A. Elevated bilirubin. B. Elevated ammonia. C. Lowered albumin. D. Lowered hematocrit. Answer, B. Rationale: elevated ammonia causes hepatic encephalopathy and hysterexis. Strategy: think liver can't detoxify ammonia, brain toxicity. Question 4. During a blood transfusion, a patient complains of back pain and chills. What's the first action? A. Stop the transfusion. B. Slow the infusion. C. Notify the physician. D. Administer acetaminophen. Answer, A. Rationale: symptoms equals acute hemolytic reaction. Stopping transfusion prevents further hemolysis. Strategy: any transfusion reaction, stop the transfusion immediately, maintain 4 with normal saline. Question 5. A patient receiving mannitol for cerebral edema develops crackles. What does this indicate? A. Therapeutic response. B. Pulmonary edema. C. Dehydration. D. Resolution of ICP. Answer, B. Rationale: mannitol can shift fluid intravascularly, overload pulmonary edema. Strategy: always assess lungs during osmotic diuretic therapy. Question 6. Which lab confirms resolution of diabetic ketoacidosis, DKA? A. Glucose 200 mg per deciliter. B. Negative ketones. C. pH 7.25. D. HCO3 15 milliequivalent/L. Answer, B. Rationale: DKA resolved when ketones clear and acidosis corrected. Strategy: don't use glucose alone, check ketones and pH. Question 7. A patient has facial droop and cannot close the eye on one side. Which finding confirms Bell's palsy, not stroke? A. Slurred speech. B. Total unilateral facial paralysis. C. Weakness of limbs. D. Confusion. Answer, B. Rationale: Bell's palsy affects both upper and lower facial muscles, stroke spares the forehead. Strategy: ask patient to raise eyebrows, inability indicates Bell's palsy. Question 8. ST elevation in leads 2, 3, and AVF suggests occlusion of which artery? A. LAD. B. RCA. C. Circumflex. D. Left main. Answer, B. Rationale: inferior wall MI equals right coronary artery involvement. Strategy: memorize ECG lead area correlations for rapid MI localization. Question 9. Chest tube shows no fluctuation and patient is dyspneic. What's the first action? A. Check for kink/obstruction. B. Increase suction. C. Clamp tube. D. Notify physician. Answer, A. Rationale: no fluctuation equals obstruction or lung re-expansion, check patency first. Strategy: always inspect before intervening. Question 10. Which finding indicates pericardial tamponade post-cardiac surgery? A. Bounding pulses. B. Muffled heart sounds. C. Hypertension. D. Bradycardia. Answer, B. Rationale, Beck's triad, muffled heart sounds, JVD, hypotension. Strategy, think heart compressed soft sounds, low BP. Question 11. Lab finding confirming acute pancreatitis? A. Bilirubin. B. Amylase and lipase. C. Alt. D. Calcium. Answer, B. Rationale, elevated amylase/lipase equals pancreatic inflammation. Strategy, remember, lipase stays elevated longer best indicator. Question 12. Heparin infusion patient has APTT of 120 seconds. What should the nurse do? A. Continue infusion. B. Stop infusion and notify provider. C. Decrease rate by 50%. D. Administer vitamin K. Answer, B. Rationale, APTT greater than 100 equals bleeding risk. Hold and notify provider. Strategy, no therapeutic range, 60 to 80 seconds, for safety questions. Question 13. Lupus patient has sharp chest pain relieved by leaning forward. Cause? A. Me. B. Pericarditis. C. Pleurisy. D. Pulmonary embolism. Answer, B. Rationale, pain positionally relieved equals pericarditis hallmark. Strategy, forward equals better pericardial origin. Question 14. Guillain-Barré patient with shallow respirations. Nursing priority? A. Check reflexes. B. Suction airway. C. Prepare for intubation. D. Increase O2 flow. Answer, C. Rationale, respiratory muscle paralysis mechanical ventilation needed. Strategy, ABC rule, protect airway first. Question 15. Furosemide patient develops muscle cramps and ECG waves. Which lab abnormality? A. Null 138. B. K2.9. C. Ca 10.5. D. Mg 2.1. Answer, B. Rationale, hypokalemia causes cramps and U waves. Strategy, remember low K equals low muscle plus low cardiac stability. Question 16. Teaching for methotrexate in rheumatoid arthritis? A. Avoid folic acid. B. Increase fluid intake. C. Report signs of infection. D. Expect mild hair loss. Answer, C. Rationale, immunosuppressant infection danger. Strategy, always teach infection precautions for cytotoxic drugs. Question 17. Electrolyte imbalance increasing digoxin toxicity? A. Hyponatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Answer, B. Rationale, low K enhances digoxin binding toxicity. Strategy, monitor K before giving digoxin. Question 18. Myasthenia gravis patient suddenly can't breathe. Cause? A. Cholinergic crisis. B. Myasthenic crisis. C. Stroke. D. Hypoglycemia. Answer, B. Rationale, underdosing or stress triggers myasthenic crisis, respiratory failure. Strategy, distinguish by history, underdose equals myasthenic, overdose equals cholinergic. Question 19. Nurse finds a firm, non-tender, fixed breast lump. Next action? A. Reassure. B. Schedule biopsy. C. Warm compress. D. Observe for 2 weeks. Answer, B. Rationale, persistent hard mass equals possible malignancy. Strategy, never delay investigation for new masses. Question 20. SIAD patient presents with confusion and seizures. Expected lab? A. Null 120 milliequivalent/L. B. Null 140 milliequivalent/L. C. K 4.2 milliequivalent/L. D. Osmolality 300 mosm/kg. Answer, A. Rationale, SIAD water retention dilutional hyponatremia. Strategy, low Na plus low serum osmolality equals SIAD. Question 21. Patient on ACE inhibitor develops swelling of lips and tongue. What is the priority? A. Stop drug and maintain airway. B. Administer antihistamine only. C. Continue medication. D. Elevate head. Answer, A. Rationale, angioedema is life-threatening airway obstruction. Strategy, for airway-threatening reactions, stop med and secure airway first. Question 22. In thyroid storm, which manifestation is most critical to control? A. Fever. B. Tremor. C. Anxiety. D. Weight loss. Answer, A. Rationale, hyperthermia causes cardiac strain and death, cooling is priority. Strategy, treat the symptom that kills fastest, fever in thyroid storm. Question 23. Post-splenectomy patient CBC shows WBC 22,000. What should the nurse do? A. Document as expected. B. Call provider immediately. C. Administer antibiotics. D. Repeat test later. Answer, A. Rationale, mild leukocytosis is expected post-splenectomy due to absence of filtering function. Strategy, no normal post-op variations before alarming the team. Question 24. A patient with sickle cell crisis reports chest pain and shortness of breath. Priority action? A. Give O2. B. Start 4 fluids. C. Give morphine. D. Notify provider. Answer, A. Rationale, oxygen relieves sickling hypoxia immediately. Strategy, in vaso-occlusive crises, address oxygenation first, then pain and fluids. Question 25. Patient with head injury has clear drainage from the nose. What test confirms CSF leak? A. Urinalysis. B. Glucose test strip. C. pH test. D. Protein test. Answer, B. Rationale, CSF contains glucose, positive test confirms leak. Strategy, use non-invasive glucose test before imaging. Question 26. Which ECG finding indicates hypocalcemia? A. Short QT. B. Prolonged QT. C. Peaked T waves. D. Flattened P waves. Answer, B. Rationale, hypocalcemia prolongs QT risk for torsades de points. Strategy, memorize calcium low equals QT long. Question 27. A nurse notes jugular vein distension and crackles in a patient on 4 fluids. What should be done? A. Slow the infusion. B. Continue current rate. C. Raise legs. D. Administer diuretic. Answer, A. Rationale, signs of fluid overload reduce rate immediately. Strategy, assess before medicating, adjust fluids first. Question 28. A patient on lithium reports diarrhea and tremors. Which action is most appropriate? A. Hold next dose and notify provider. B. Give antidiarrheal medication. C. Encourage fluids. D. Continue therapy. Answer, A. Rationale, early lithium toxicity equals GI upset plus tremor. Strategy, diarrhea plus tremor equals danger, hold lithium. Question 29. A patient with meningitis shows petechial rash and hypotension. What does this indicate? A. Viral infection. B. Disseminated intravascular coagulation, DIC. C. Drug allergy. D. Dehydration. Answer, B. Rationale, rash plus hypotension equals DIC from septicemia. Strategy, recognize petechiae plus low BP as DIC alarm. Question 30. Post-thyroidectomy patient suddenly develops stridor. First action? A. Call rapid response. B. Assess for hypocalcemia. C. Give humidified oxygen. D. Prepare for tracheostomy. Answer, A. Rationale, stridor equals airway obstruction from edema or hematoma. Strategy, airway emergency activate help first. Question 31. A patient on TPN develops sweating and confusion. What's the cause? A. Hypoglycemia. B. Infection. C. Fluid overload. D. Electrolyte imbalance. Answer, A. Rationale, abrupt TPN stop rebound hypoglycemia. Strategy, always taper TPN gradually. Question 32. Which drug should be avoided in glaucoma? A. Atropine. B. Timolol. C. Pilocarpine. D. Mannitol. Answer, A. Rationale, atropine causes pupil dilation increases intraocular pressure. Strategy, anything that dilates equals danger in glaucoma. Question 33. A patient with Cushing syndrome is at risk for A. Hypoglycemia. B. Hypertension. C. Hypovolemia. D. Weight loss. Answer, B. Rationale, cortisol excess equals sodium and fluid retention high BP. Strategy, connect cortisol to cushioning effects, BP, glucose, weight. Question 34. A nurse finds a patient unconscious with a blood glucose of 30 mg per deciliter and 4 line intact. What should be done first? A. Give 50% dextrose 4. B. Give oral glucose. C. Call provider. D. Check vital signs. Answer, A. Rationale, immediate correction with 4 dextrose prevents brain injury. Strategy, always treat life-threatening hypoglycemia before notifying. Question 35. Patient with MI develops new S3 heart sound. What does this indicate? A. Mitral valve stenosis. B. Left ventricular failure. C. Pulmonary embolism. D. Pericarditis. Answer, B. Rationale, S3 equals ventricular overload and heart failure. Strategy, think S3 equals fluid backs up. Question 36. Which finding indicates hyperparathyroidism? A. Hypocalcemia. B. Bone pain and fractures. C. Muscle spasms. D. Trousseau's sign. Answer, B. Rationale, excess PTH bone resorption pain and fractures. Strategy, hyper equals bones thin, hypo equals muscles twitch. Question 37. Patient with DVT develops sudden dyspnea and chest pain. What's the priority? A. Administer O2. B. Call rapid response. C. Place in Fowler's. D. Check pulse oximetry. Answer, B. Rationale, pulmonary embolism suspected emergency. Strategy, ABC plus life-threatening event equals activate help immediately. Question 38. A nurse is administering vancomycin 4 and notes red flushing on the face and neck. What should be done? A. Stop the infusion. B. Slow the infusion rate. C. Administer epinephrine. D. Give diphenhydramine 4 push. Answer, B. Rationale, red man syndrome equals infusion too fast. Slow rate to greater than or equal to 60 minutes. Strategy, not an allergy, adjust infusion speed. Question 39. Patient with acute glomerulonephritis has cola-colored urine and edema. Expected finding? A. Proteinuria and hematuria. B. Polyuria. C. Glycosuria. D. Ketonuria. Answer, A. Rationale, glomerular inflammation protein plus blood leak. Strategy, Coca-Cola urine equals glomerulus leak. Question 40. Which sign indicates hypovolemic shock? A. Bounding pulse. B. Cool, clammy skin. C. Hypertension. D. bradycardia. Answer, B. Rationale, peripheral vasoconstriction equals cool skin and shock. Strategy, recognize early compensatory signs, tachycardia, cold skin. Question 41. A patient with anemia reports pica, ice craving. What does this suggest? A. Iron deficiency. B. Vitamin B12 excess. C. Folic acid toxicity. D. Hemolysis. Answer, A. Rationale, pica is characteristic of iron deficiency anemia. Strategy, memorize ice equals iron. Question 42. A patient on warfarin has 6 Indian rupees with no bleeding. What should the nurse expect? A. Hold dose and give vitamin K. B. Continue dose. C. Double next dose. D. Start heparin. Answer, A. Rationale, INR5 risk of bleeding, antidote equals vitamin K. Strategy, high INR equals hold plus K. Question 43. A patient with chronic renal failure develops K equals 6.8 milliequivalent/L. Which ECG finding is expected? A. Peaked T waves. B. Flattened P waves. C. Prolonged QT. D. U waves. Answer, A. Rationale, hyperkalemia causes tall peaked T waves. Strategy, always link K with cardiac rhythm clues. Question 44. Which drug must never be given 4 push? A. Furosemide. B. Potassium chloride. C. Morphine. D. Diazepam. Answer, B. Rationale, 4 push potassium can cause immediate cardiac arrest due to rapid depolarization. Strategy, always dilute and infuse KCl slowly via infusion pump, never push potassium. Question 45. A patient on total parenteral nutrition, TPN, develops a fever and chills during infusion. What is the most likely cause? A. Fluid overload. B. Catheter-related infection. C. Hyperglycemia. D. Hypocalcemia. Answer, B. Rationale, central line contamination is a major TPN risk. Strategy, always use strict aseptic technique and change TPN tubing every 24 hours. Question 46. A nurse notes that a patient with a tracheostomy has bubbling at the insertion site during coughing. What should be suspected? A. Air leak around the stoma. B. Secretions in the tube. C. Tracheal obstruction. D. Normal finding. Answer, A. Rationale, bubbling indicates air escaping subcutaneously, a sign of poor seal or dislodgement. Strategy, assess stoma security and cuff pressure immediately. Question 47. A patient with severe burns develops a urine output of 10 milliliters per hour and a dark, tea-colored urine. What complication is suspected? A. Sepsis. B. Acute tubular necrosis. C. Myoglobinuria from muscle damage. D. Dehydration. Answer, C. Rationale, burn-induced muscle injury releases myoglobin, which clogs renal tubules. Strategy, always monitor urine color and output in burn patients to prevent renal failure. Question 48. A nurse is caring for a patient with a spinal cord injury at T4 who suddenly becomes flushed, sweaty, and hypertensive. What should be done first? A. Sit the patient upright. B. Administer antihypertensive medication. C. Check blood glucose. D. Call provider. Answer, A. Rationale, autonomic dysreflexia elevate head to decrease BP and prevent stroke. Strategy, ABC rule, control BP by positioning first, then find the trigger, bladder, bowel. Question 49. A patient in diabetic ketoacidosis, DKA, is on 4 insulin infusion. Which intervention prevents hypokalemia? A. Give potassium supplements even if K is normal. B. Restrict fluids. C. Stop insulin early. D. Increase insulin rate. Answer, A. Rationale, insulin drives K into cells, causing sudden hypokalemia unless replaced. Strategy, always replace K as soon as urine output is adequate during DKA therapy. Question 50. A postoperative patient suddenly becomes short of breath with anxiety and chest pain. O2 saturation drops to 84%. What is the priority action? A. Apply oxygen and raise the head of the bed. B. Start CPR immediately. C. Obtain ABG first. D. Check incision for bleeding. Answer, A. Rationale, classic signs of pulmonary embolism, apply O2 and sit upright to improve gas exchange. Strategy, always address oxygenation first before diagnostics in acute respiratory distress. You've just mastered 50 of the most challenging NCLEX-style medical questions. If you found this helpful, subscribe to NCLE's Medizi 91 for more daily questions, rationales, and strategies to make passing the NCLEX feel easy.